Welcome to the Yamasatomi Journal Club. I'm Yamato, your host, and I'm delighted to be joined again by the insightful Dr. Satomi. Today, we're delving into a crucial study focusing on localized General Practitioner (GP) training in rural Queensland, Australia. This research tackles the vital issue of ensuring equitable healthcare access for people in underserved rural communities and offers valuable insights for strengthening healthcare systems globally.
Thanks, Yamato. Access to primary care is fundamental to public health, and ensuring a well-distributed, robust primary care workforce is essential for an effective healthcare system. This is particularly crucial in underserved communities. This study provides valuable data on how localized training programs can contribute to addressing workforce shortages and disparities in healthcare access in rural areas.
Let's start by examining the background of this research. Dr. Satomi, what specific challenges were the researchers hoping to address?
Many rural and remote areas struggle to recruit and retain GPs, leading to health disparities and limited access to essential primary care services. This study aimed to understand how a localized training model, which provides training and support within these underserved communities, could potentially mitigate these challenges.
How did the researchers approach this question? What methods did they employ?
They used a qualitative approach, conducting in-depth interviews and a focus group with key stakeholders in rural Queensland. Participants included GP registrars currently in training, their supervisors, practice managers, healthcare service staff, and community representatives. Gathering diverse perspectives like this allowed them to gain a more comprehensive and nuanced understanding of the impact of localized training programs.
What were the key findings of this research?
The research revealed that localized training has a multifaceted positive impact on both GP registrars and supervisors. Registrars reported improved access to training opportunities that are often difficult to access in rural areas, such as personalized mentoring from experienced supervisors and access to online resources. They also gained broader practical experience due to the varied and often complex cases encountered in rural healthcare settings. This diverse experience allowed them to develop a wider range of skills. Importantly, the training also included a focus on rural-specific health issues, enabling registrars to develop a deeper understanding of unique regional health challenges and cultural sensitivities.
So, the training not only enhanced their skills, but also made the prospect of working in these areas more appealing.
Precisely. The study found that the training highlighted the inherent advantages of rural practice, the strong sense of community, the potential for a better work-life balance often found in smaller towns, and the opportunity to make a real difference. By experiencing these benefits firsthand during their training, many registrars developed a more positive view of rural practice.
Did the study identify any ongoing challenges or barriers?
Yes, several ongoing challenges were also brought to light. The need for improvements to workplace infrastructure and resources, such as providing up-to-date equipment and adequate staffing, was identified as a key concern. Family-related considerations like access to quality education for children and job opportunities for spouses also continue to present barriers. Furthermore, the geographical isolation of these communities, often with fewer amenities and services than urban centers, poses a difficulty for recruitment and retention.
Dr. Satomi, based on your expertise, what are your thoughts on the strengths and limitations of this study?
The qualitative methodology offers valuable insights into the experiences of those directly involved in localized training. However, it's important to acknowledge that the study was limited to a specific region of Australia. The findings may not be generalizable to other contexts and healthcare systems with different characteristics. Further research with wider participation, including more diverse demographic groups, would strengthen the research and ensure that results are more inclusive and address potential disparities within the medical workforce.
That's a vital point about generalizability and the importance of inclusivity in research. So, to summarize, what are the key takeaways our listeners should remember?
Localized GP training programs offer significant promise in addressing workforce shortages and improving healthcare access in underserved rural communities. These programs enhance the training experience and highlight the sometimes overlooked advantages of rural practice. However, for long-term success, it's crucial to address systemic barriers related to resources, infrastructure, and family support. A comprehensive approach that tackles these issues is essential for a sustainable rural healthcare system.
Thank you, Dr. Satomi, for that insightful analysis. This study offers important lessons for policymakers and healthcare systems, striving to strengthen rural healthcare delivery. The full article is Peel et al. 2020 in BMC Medical Education, and we strongly encourage our listeners to read it. Join us next time for a discussion of topic of next episode.